Welcome back to the Women in Movement podcast. We are here with Teresa Iodice-Dadin, who is a physical therapist and a manual osteopath in New York City. Teresa works at NYU and through her own personal practice. Teresa, can you define what a manual osteopath does or what manual osteopathy is?
Okay. Yes, of course. So the field of osteopathy was created back in the I believe it was 1870, the late 1870s. And it was created by a man by the name of Andrew Taylor Still, Dr. Still. Basically, what he wanted to do was to use his hands. In fact, in the early days, the osteopaths would call the 10-finger doctors because they use their hands to sort of bring balance to the human body. And there's a lot of tenets to osteopathy, but one of them was if you the body is what heals itself. If you remove all the obstacles, if you sort of bring rebalance, it will then take over and do the healing for you. So manual osteopathy is based on the concept of knowing good anatomy, knowing if things are out of place, so to speak, that could bring disharmony within the system. And so what he did was he created a lot of different techniques. One of them, for example, is myofascial release. The other one would be visceral manipulations. There's so much in that he offered the field. He and then later on other osteopaths like Dr. Sutherland brought in the concepts of cranial work. And then later on down the line, Dr. Upledger took the cranial concepts and basically packaged it in a sequence of 10 steps so that he felt that the average person could learn those 10 steps and help many more other people. So what manual osteopathy is a different number of techniques that when put together, and we know what the restriction in the body is, we could give it a little bit of a fulcrum. We can give the body a fulcrum so that those restrictions can be removed. And then the body itself will re-regulate. So the concept in osteopathy is never that the clinician heals. The concept is that you remove the obstacles so that the body can then heal itself.
Yeah.
A very different approach than, here, take this medicine and it'll make you better. Right?
Yeah, right. Yeah. I love that approach. I think that it's beautiful to realize that the body has this ability to heal itself and to trust that process as opposed to searching, outsourcing other quick fixes for that process. Yeah.
I mean, even when with medicines, for example, even when doing antibiotics, at the end, it's the body that will kick in and totally heal the person. So there's a certain amount of things that the medicine can do, but in the end, it's really the body that heals. So, and I think that was one of the points that Dr. Still wanted to incorporate in this field of osteopathy that he created. I mean, there are a lot of tenets to osteopathy, like structure and function. So, if you look at some structure, you more or less can figure out what it does. Like the gills on the fish in sort of the respiration of the fish was what Dr. Sutherland, when he created cranial work, noticed the temporal bone was very similar to the gills of a fish. And so he associated that to respiration and how the cranial bones can help with the body's respiration. Not so much as in breathing with the lungs, but it's a different definition altogether. Yeah.
Interesting.
So it's that is the basic tenet of osteopathy. And so you give the body, you take away the restrictions, and the body can then normalize and go on. Because what we believe is that every cell knows nothing more than good health. And it's driving towards that sort of universal wisdom that exists within the human body of what good health is, that it wants to achieve good health, and that sometimes it can't because it's incapacitated by something that is present. Whether it's a physical restriction, whether it's an emotional restriction, whether it's a toxin that people are exposed to through their food or whatever. But if we were clean of all those things, then the organism, the body would be healthy and well, because that's the only information that really drives every cell of our body.
Yeah, that's
Isn't
beautiful.
that beautiful?
I love it.
I do too. This is the sort of thing that excites me in going forward, is that people don't realize that there is, your cells have so much wisdom. In fact, this is a beautiful thing that I read years ago that really amazed me. It was an Italian scientist who wrote a book on cancer and the failing in cancer. And when people develop cancer, there's a lot of breakdown of systems that we can't even imagine. And the very first defense system is intracellular communication. For example, the neighboring cells will know when a cell becomes cancerous or when a cell is not normal. And the neighboring cells will try to coach that cell to re-regulate itself so that it can do its work. And if one recommendation doesn't work, then the cells will continue to work with that abnormal cell and trying something different. And if there's failure, then the neighboring cells will say, you're going to have to auto-kill yourself. You're going to have to extinct yourself because you're not regulating yourself. Every cell has the right to self-destruct. And it will do that when it realizes that it cannot change to do well. And so it starts from there, that first level of failure. It's amazing how many systems exist within the human body to nurture good health. And I wish people would know that all of that information really is through evolution. It's through so many years of evolving to having that presence. So it's all part of this whole wonderful system that makes us up.
Yeah. And speaking of systems, I think recently, in the past couple of years, we have really gotten a lot more information on the lymphatic system and lymphatic drainage and techniques that cultures have been doing for, thousands and thousands of years, but now with like a purpose of, you're actually activating the system in a different way or clearing the system out.
Right. So there's many massage therapists do the lymphatic drainage. There's in osteopathy, for example, in treating diseases like chronic fatigue. So what is recognized in chronic fatigue is that the person is sitting in toxic material. That's your lymph, right? And by the way, something about the lymph. The lymph is the basic fluid source of the human body. I mean, we have mainly three: the blood, the lymph, and the cerebral spinal fluid, right? So if you look at the cerebral spinal fluid is lymphatic, that is filtered through certain cells and then becomes the cerebral spinal fluid. Plasma, which is what circulates the red blood cells and the immune cells within the blood as we speak, plasma is part of the lymphatic system. So really the origin of all fluids within the human body is the lymphatic.
Right.
So in treating chronic fatigue, there's an osteopath in Manchester, England, by the name of Dr. Perrin, Perrin, and he developed a system where he does lymphatic drainage in particular areas to sort of cleanse the toxins that are making the person fatigued. Okay, so if you sit in toxin, you can't function normally. And of course, chronic fatigue not only affects your inability to have the energy to get up and do things, but it also causes foggy headedness, cloudy headedness. These are the sort of terms that people use to sort of convey that their brain is not working either.
Right.
And we know now that there's lymph in the central nervous system as well. So you're basically bathing in toxins, and ideally you have to clean it out. And so the Perrin technique, which is what Dr. Perrin created, targets certain areas of the body, like the breast area where there's a lot of accumulation of toxins, the the cranial to get the central nervous system moving, the fluids within the central nervous system moving, the thoracic ducts, which sort of accelerate the movement of the lymph. So yes, lymph is really, the lymph and fascia are the two systems that are least understood in allopathic medicine. And according to osteopathic medicine, or osteopathic manual techniques, those two systems are probably the essence of life. I mean, that's where a lot of feeling and good health originate from, those two things. So yeah, absolutely. I think you hit the nail right on the head. The more we address these things, the more we can really treat chronic pain, chronic fatigue, all these other diseases that really mainstream medicine post-COVID, which is really in the field of chronic fatigue, and dysautonomia. This is another thing that's coming up, where the autonomic nervous system is not regulated well. So people faint, they have high, heart rates that are off the charts. They become nauseous, and there's a lot of visceral involvement, gastric involvement. So all of this is part of those systems that go berserk.
Yeah. And also, I think there's a lot of research and questions into the hormonal systems these days too, with fertility and developments in women's bodies. Yeah. So I'm sure that has a lot to do with the regulation of the body as well.
It's so interconnected. I mean, everything is so interconnected. Your the brain is the pituitary gland is where a lot of your signaling for hormones stems from. And there's so much that we're doing in this day and age that is really creating, it's creating us to be in toxic states. That, I mean, our food is no longer real food. Most of it is genetically modified. So we're already starting. I mean, if we cannot depend on the earth and the things around us to sustain good health, we cannot have good health. And so the conversation with regards to, the infertility, we really have to look at all the things that we do, starting from birth and on, everything that we inject into our body, everything that we drink into our body, everything that we breathe. And I also believe that the way that we feel, I mean, if we look at what a lot of our younger people are exposed to and what they're spending their time doing, then we start to see that even in their thoughts are being polluted. It's not just the body, but it's their mind as well. And health is not just physical health, it's your mental health, it's your, I don't want to use a word that is thought of as being religious, but it's your spirit, right?
Spirit. I don't think that that's even religious. I think the word spirit is something that's inside of you that it can go in different directions based on where you want it to go. But that's something that's beautiful. I don't think it needs to be a negative word at all.
Because I don't know how some people might take it. But if you don't have a clean spirit, if you don't have a spirit that is full of enthusiasm and positivity, it will affect your mind and your body. People always come to me with, trigger points in their upper traps, in their neck, in their jaw. And they say to me, what's wrong with me? And I, how can I answer the question? I have a lot of pain here. And so when I go through all the possibilities, how do you sleep? What do you do? What's your posture? What's this? And if it's not significantly bad, then I will say to them, what has happened in your life this last couple of years? I had a patient yesterday, a young woman, 24-year-old, very healthy, a beautiful, vibrant young woman, has had back pain for a year and a half. They did diagnostics. They saw nothing that could possibly bring the pain that she was experiencing. So she had significant pain to the point where she couldn't get out of bed.
Mm-hmm.
And so after going through all the check of, ruling out, did you fall? Did you have an accident? Did you, a sport injury, a repetitive? Do you sit all day? No, but she was saying she does sit, but she says, I make sure that I get up and she does all the right things.
Mm-hmm.
I had to come to the last question, which was, I checked off all the boxes as far as what could physically hurt you. I said, has something happened in your life in the last year and a half that was, that hurt you?
Mm-hmm.
And she thought about it. And then she turned to me and she said, I was in California. My mother was battling breast cancer for a year and a half. And when my back pain started, I was in California taking care of her.
Yeah.
Well, there you go.
Yeah.
It's your emotions affect your level of well-being and many times can cause or magnify the pain that you're experiencing.
Right. I remember you also had a story. Well, we've had many conversations, so I want to back this up real quick for the audience, but I have come to see you 3 times. The first time was just for an awareness of my own body as a movement practitioner and facilitator in New York City, just to understand where my imbalances were, where I was super tight, knowing that I had Crohn's and colitis previously in my younger adult years. And then I left here and I was like, I can't bike home. And I got on the train. I was walking to my house from the train and I just started feeling my organs shift around in all these different ways. And I was like, oh my goodness, I haven't felt this freedom in my stomach for a very long time. I don't even know if it ever happened. And then I slept for 12 hours. And then
that's usually what happens.
Yeah. Another time it was for a birthday celebration with one of my friends and we came together, and the last time was due to an injury. And every time I've left with so much insight from you as a practitioner through my own body, but also just in conversation. So I just think that you are a beautiful practitioner, and I'm very grateful to have met you.
Thank you so much. It is compliments like that give me the energy to keep working hard. Because believe you me, there are many times where I come home and I say to myself, have I done anything to change people's lives?
Yeah.
I guess we all do that, but thank you for saying that, because that really is the what keeps us going, is to hear that we do touch people's lives and we make a difference in their life. And many times, I tell people it's not me, it's these techniques that are amazing.
Right.
I remember when I was studying osteopathy, and I guess I should let people know, in America, there are different levels of osteopathy. And I want to make this very clear because people become very territorial.
Mm-hmm.
There are the man that I spoke to you guys about, Dr. Still, he was a doctor of osteopathy, and he started the osteopathic school in Kirksville, Missouri. That's the first school of osteopathy. Unfortunately, the DOs, the doctor of osteopaths, have left doing the manual work that Dr. Still really wanted to let the profession, I guess, to represent the profession. And what they did after his death and many years later, the American Medical Association invited the DOs to do residencies with them as a way of raising their prestige in society. And so the DOs accepted. And so if any of you see a DO in this day and age, in America, a DO is like a medical doctor. They do exactly the same thing that a medical doctor does, which was not what Dr. Still wanted the profession to offer. The irony is that if you go outside of the United States, anywhere else, in Canada, in parts of most Canada, the French parts of Canada, England, Europe, South America, Australia, a DO is a true manual osteopath. As a result, a niche was left open in America as far as who's gonna do these skill sets that were left behind. And so a lot of manual therapists then went and got training to do the manual osteopathy.
Gotcha.
Hence, I went up to Canada There's Dr. Philippe Drouel, who's a French-trained osteopath. When he moved to Montreal, he started the first Canadian College of Osteopathy that focused only on the manual osteopathy. And so I went to his school in Toronto for 5 years. It's a 5-year program.
Yeah.
And so if you go to England and you ask for an osteopath, you're going to get a manual osteopath. But if you come to America and ask for a doctor of osteopathy, you're going to get a medical doctor. So you really have to, that's the distinction between a DO and a DOMP, a diplomat of osteopathic manual training. And then there's a slew of other practitioners that have taken courses with the Upledger Institute or the Barral Institute, and they know a mixture of different manual osteopathic techniques. I guess the biggest difference between having undergone a 5-year program is that you really learn about the philosophy a lot more than you can in these weekend training courses, because they don't have time to really treat the philosophy. So, I mean, I can really speak to you about the philosophy of osteopathy, a little bit about the history of osteopathy, because I really have spent many more years listening to people talk to me about that. So that's about the difference, I guess, that I would say. So going back to your original question was your experience with me. I mean, it's amazing to me how many practitioners don't realize that your organs in your gut, in order for them to stay where they are, they have to suspend on something strong, the structural skeleton.
Right.
And so, you know, your heart and lungs throw what we call them are suspensory ligaments. They throw ligaments onto the thoracic spine to stay in place. Your gut and your abdominal organs, including pancreas, kidneys, and also the genital ureteral organs, they all have to have suspensory ligaments and throw them onto the structural skeleton, a bony part of the skeleton, so that they can stay in place. Right. Otherwise, imagine anytime you would do your running or your hand, what do they call
handstands?
Your handstands, your organs would sort of fall out of place if they're not suspended. But knowing this also teaches you something else. Remember, structure and function, as we said before. If there's any inflammation to an organ, that will weigh down on the spine, and so can start spinal pain. Contrary to that, if your spine has had surgery and is not flexible, it then takes away the flexibility from your organ that suspends on it. So it goes both ways as far as, you know, good health at this point. Then if somebody comes to me with a very rigid spine and complains of a GERD or something like that, I might mobilize the spine and see if that clears up the GERD or some other issues. Or if someone has had Crohn's disease, which is an inflammation of the large intestine, that may have caused some heaviness on the spine. So the person may start to have back pain. So in this case, I would treat the intestine and the scarring that is left behind, you know, after the inflammatory processes, and then see whether the back pain gets better. So I have treated many people in my lifetime. I mean, I'm a manual osteopath since 2001, so 24 years, and I'm a physical therapist since 1985, so that would be 40 years. And the two combined is such a beautiful marriage.
Yes.
The two of them combined really gives me such an ability to not only understand and see the problem, but also to add some physical activity, some exercises that would address it down the line or that would help down the line. So I think it's funny because my path in reaching these two profession in life was not a straight one. I sort of meandered in sort of a, roundabout sort of a way before I stumbled upon the other one. And then together, I feel it really makes a lot of sense. So when I first see people, I do an incredible assessment of their body. And not just what they came in to see me for, because usually that's what most people get these days. I know, like you said, I work at NYU. So when some people or when people come to see me or they come to see colleagues of mine with neck pain, only their neck gets to be evaluated. Or, any other body pain, only that part gets to be evaluated. And I think the reason why that's done is time limitation is always an issue. But the second thing, it's your standard of care that is recognized by the powers that be. If you go above and beyond that, that goes beyond the proper, what is expected of you.
Right.
So if somebody comes to me with neck pain, but I assess their sacrum, in a regular facility, I would be told, "What the heck are you doing?"
Yeah, you're like, well, it's the other side.
Right. But as an osteopath, I will say, there's nothing that I see wrong in the neck. I have to go and check the rest of the spine to see where the problem can stem from, because it isn't there.
Right.
And these are the patients that I usually see, is those people that have been seen by other practitioners and they weren't helped, because the problem doesn't stem from where the pain is calling out from.
Yeah, that's beautiful. So I just want to say personally, from my visits with you, as a person who has a large understanding of their own body, I think it's such a treat to give yourself a session with an osteopath, because you are able to really hone into your body. Like when you're releasing certain areas, I was noticing what the rest of my body wanted to do and where it wanted to go. Like you were releasing a certain area on my right abdomen and my like left shoulder, in certain spaces wanted to move. There was a release, the iliac crest in my left side, and my left big toe wanted to move and wiggle like crazy. So understanding that some of my Achilles issues on my left side could be stemming from the tightness in my left abdomen. Or as you had said before, with the back and the front of the body and the organs, you released a part of my back, to the right side of my spine, in a certain area. And I still know where it's at, but I just felt my organs released in the front. So as a practitioner or anyone who really is in tune with your body, it's a beautiful experience to have, to go to someone and have them do the manual work. And you're just like, oh, this wants to go here and this wants to go there. And having this way different understanding of your own body. And
I'm so glad you said that, because one of the things that I think people have to understand is that there is no exact way where an injury can express itself. It is a lifelong of that person's injuries that will dictate how a fall is absorbed in the body and the tightness that it can cause. For example, you're so right. Now, when I released your iliac crest, would the tissues around there, would I absolutely have known that your toe would have released? Absolutely not. I have no idea what I'm releasing, because the body is who keeps the score, right? I would have to know every injury that you have had and how it impacted the angle, the vectors, how it impacted your body for me to figure out. And then I would have to be a physicist to figure out at what angle I'd have to release the fascia to release that part of your body. So when I feel restrictions is what guides me in my treatment. And the repercussions at the other end of that could be widespread, from toe to abdomen to head. I have nobody can control that. But one of the things, and I know people will say, how can it be that your toe released when you release the tissues in the pelvis? The fascial chains are long.
Yes.
They're long. Some of them go from toe to head. And along such long sheets, you can have multiple injuries from past experiences that will torsion the sheet so that it directs the force in different ways. And there's no way that the individuals who's experienced this would know that. And there's even less of a way that the practitioner knows all that, because I would have to know all of the injuries the person has had and what angle they were hit and how it does. So the best we can do as practitioners is treat an area where we identify as tight and then see where it leads to. So exactly what you said. And people that have very intuitive understanding of their body get it. Because they'll lay on my table, and usually when I treat, I don't like to talk to people because I want them to experience that. There is healing in stillness and in quiet, which I always emphasize. And I mean, there are patients that want to talk to me. In fact, I had a few saying, "Can I speak?" And I said, "Sure, you can speak," but you're taking it away from your ability to go inside and feel what my techniques are doing for you, so that you too can see the connections between the different areas, because sometimes they're mild. It's not that you see the strong release. It's a sort of a tingling somewhere else, or a general or light pull somewhere else, and that actually connects the dots for you as far as what the link in that pattern is, that only you can experience this because you're on the table being treated.
Right. And I think that it's an experience that can last with you longer, right, than being just told that your right index finger has a fascial line that connects to up your shoulder into this area of your neck. Like, you know, it's this, you're actually experiencing the thing in action, the tightness, the release, you're going through the whole process in action. And if you're not talking, it does allow you to breathe into it and allow things to get deeper, and allowing to understand pressure in a different way. I think that as a human species, like we don't get touched as much as we used to anymore. We don't understand pressure in the same ways. We're very afraid of certain forms of touch and like harming people or coming across it a different way. So we're also like just malnourished in that area as well. And I think you can learn a lot from receiving pressure and even pressing back a little bit into that pressure with whatever body part you have,
or your breath. I mean,
or your breath.
I mean, if you've done a podcast on, not that I can do it, there are people that are better qualified than I am in breath work. I think that is an amazing way that even if you learn how to breathe and breathe into things, that creates what I create externally with breath work, you create internally. And when the two meet together, you have such releases to the fascia that it is beautiful to see. I remember when I was studying, again, we were in Toronto, and sometimes when the professor taught a lesson, he would, have a student come on the mat. And in this particular case, there was an issue with the chest, the thoracic cage. And he had one person, I remember, he had one person on the head doing a traction, a suboccipital release. He had another person.
Sorry, can you explain what a suboccipital release is?
So the cranium, at the base of the cranium, the bone is called the occiput. So if you put your finger between the neck and the occiput and just pull towards you, you're doing a release to that particular area. It's a powerful release. So he again, we're students in the class, so we know the techniques, but it takes years to feel. And this is so important, because anybody can learn the technique, but then to hone in on what it is that you're touching and what you're feeling is a total different realm of self sort of, you have to sort of discover it yourself. Those are things that are, maybe they're taught to you, in that this is what you could feel, this is what you should feel, but you have to feel. And so then you have to go out and do the work. But going back to that case, I was on the, he put me on one side of the thoracic. So I had to compress the ribs, and I had to pull the spine towards me and compress the ribs towards the other person on the other side that was doing exactly the same thing as me. And then he had a fourth person on the feet of the individual, pulling at both feet, which is tractioning the fascia, the longitudinal fascia. Now, I was a student. I was a disbeliever. I was standing there holding on to the ribs and the back, and I'm thinking to myself, we're waiting, because I think the most challenge in osteopathy is that you have to wait for what it is that you're doing to have an effect on the tissues underneath you. And that doesn't happen pronto.
No.
It can take a little time. So you have to sit there and wait. You have to be able to experience that and feel that. And I remember thinking to myself, how long is this going to take? What am I supposed to be feeling? What, this is 4 of us on the body. This is crazy. And then something happened. I felt under my hands a shift. And I swear to you, I started to tear up because it was such a moment of, this is what you're doing.
Yeah.
The body's saying, thank you.
Yeah.
This is what I needed. And that's what I thought I felt under my hand, a correction that I would never mistaken. And so if a novice, as myself back then, could feel that and change my whole life, you know, I think once you feel something, or once you see something, or once you experience something, you become a believer, and there's nothing that can take it away from you after that. And that was my aha moment in osteopathy, was that feeling, that shift in the whole complex of, you know, the organs, the lungs, the heart. It was unmistakable. And and then the funny thing was that the professor at the feet felt it too. He felt it too. The guy on the head felt it too. And everybody, the 4 of us on the body, felt something.
Right.
So that the communication is not just here, but you actually feel it all across. And then everybody, you know, the patient takes a deep breath, you remove your hands, the person stood up, and you could see, I mean, besides the person standing up straighter, he was glowing. I mean, that's the other comment that I hear a lot of patients say when they come in with a loved one or with somebody else. This just happened 2 weeks ago. The wife and the husband, I treated the husband. The husband, after he stands up from the table, the wife said, "You're glowing. You look different. You look better balanced. There's something about you that has changed."
Yeah.
And sometimes people can't describe the change, but they feel it. You could describe it because you have a better sense of your body. I mean, you're an athlete. I'm sure you've worked with breath work. You've done a lot of other healing work as well, not just training people on their physical body. I'm sure you could feel it. But other people can see something and use other words for it. So it's a beautiful, I'm so lucky. I really feel so lucky that I'm in this profession.
Yeah.
It's amazing.
I'm sure, like, also for the many, many years that you stated that you've been doing work as a physical therapist and an osteopath, I'm sure you have so many client stories that just hit you in different ways. I know at one point you did speak about a client who had issues in their abdomen, and then realized as you were doing it, the release, that they just kind of held a lot of pressure since they were a child.
Oh my goodness, that was some. It was how old was he? In his 20s, late 20s, early 30s, a man, and I never experienced such emotional release as I did with this man. And he came to me for, I think it was back pain. And structurally, I mean, listen, you're not going to be, you don't get to be 30, 40, and 50 without some structural changes. And one of the things that I really want people to understand is that, let go of this concept of I have a bulge disc. Bulge disc doesn't mean that you have to have back pain, because a bulge disc is a dynamic state. It comes and it goes. And if I were to tell you that so many people have bulge disc and they don't even know about it, that if I ever see that on an MRI or not an X-ray, but you would see it on an MRI, I wouldn't look at it as the cause of people's pain. And so there's a lot more to that than just these structural changes. But this young man, when I said to him, again, he came to me with the structural pain, back pain, and I felt the abdomen, and I said to him, I said, "Oh my gosh," I said, "this is so rigid. I can't even begin to break the rigidity in the abdomen." He started to cry. He started to cry. And he said, "When I was a child, I was always told to suck it in, and to be a man about it." And he started to cry on the table. And I knew that was a problem. And so I started to work on the abdomen, trying to release that rigidity. And I have to say that he was significantly better. And I think he got it. He really got it. I mean, it's amazing how much people have absorbed through life, and it becomes a physical crutch at some point. So, we're complicated beings.
Right.
Primary and foremost, we are emotional beings, right?
Yes.
I mean, I've always said to people, if you pin your emotions against your rational brain, my money goes on the emotions. They will always win. So you can just, we are the top of our species because of this rational brain. But when you look at the strength of love and you look at the strength of hatred and bitterness and all of that other stuff, forget about the rational brain. It's the perfect example, of course, is people who are afraid of spiders. Spiders are these small creatures, just their size. You can step on them and kill them. There's no need to be afraid of them. And yet the fear eats these people up. The phobias are an example of how strong emotions can be. But we also see when people are in love, how healing love can be. They're flying all the time. They all of a sudden they have more energy. I mean, everything changes. So the relationship between emotion, the immune system, the endocrine system, all of the other systems is so intertwined and important that yes, I have so many stories, and it really, a lot of it always comes back to, obviously you have the people that have had trauma, right? But a lot of it comes back to, emotions. Yeah. I would say, especially when we speak of fascia. Yeah. Especially when we speak of fascia.
Yeah. And so, speaking of emotions, I actually think this would be a good segue into your work at NYU, some specialties with the face.
Yes.
So, can you speak a little bit about some of the common patients you're encountering with facial needs? Is it from the neck up, or what is
so it is from the neck up?
Okay.
And a lot of it is with the jaw.
Okay.
And in fact, if anybody has studied craniosacral or biodynamic craniosacral, which is slightly different than mainstream craniosacral, the jaw is an incredibly important part. If anyone has done any reading on the jaw and the issues of why people have jaw pain, oral facial pain, or anything associated with that, or even headaches which are associated with the jaw, it really leads you back to people's stress, and hence their it's called paroxysmal function, which really means these people engage in grinding and clenching either during the day or at night. And so those behaviors are usually, for the most part, the reasons for jaw and facial pain. And so many times, I've done so much research on this because it is one of my specialties. They go back and forth, and for many years they used to blame poor bite, someone that the bite is off, on the cause of clenching and grinding, and it can. I mean, obviously, if your bite is off, you're constantly sort of fidgeting around with your mouth trying to get that right spot. But there's been a few studies that actually have shed doubt on the correlation as that being the pure and only reason why people have jaw issues. And so the only other reason really is stress.
Right.
And I've thought about this. I can't quote any studies, but it makes perfect sense. I mean, intuitively, as children, what do we do to a crying child to quiet them down? We give them a pacifier, we give them a bottle, we give them something, and they start to suckle. And that suckling action soothes them and it calms them down. I believe that the mouth is wired to the pleasure centers in the brain to sort of quiet it down and to sort of soothe the soul, if you will, in my using that expression. So clenching and, grinding become that
suckling for adults.
Like the soothing.
Right.
It's very interesting. And then at night,
right,
that's how you soothe.
Exactly. And so the body intuitively does something to calm itself down, and it starts to grind and clench. And so I always, I'm very careful, and I'm very curious about why some people do it and not others, or,
Right.
you know, obviously some people do it at some time. And I will tell you, most of my patients who do clench and grind will tell me, I've been so stressed out, my grinding was off the charts.
Right.
So they tell me.
Yeah.
And I have to say, well, obviously you needed to calm yourself down, in some way. But, I guess I will introduce the idea that even besides the grinding and clenching, what are some of the other activities that people use to sort of feed their soul? Eating, right?
Mm-hmm. Right.
Drinking, smoking.
Mm-hmm.
I mean, it all has something to do with the stimulation of the mouth.
Yeah.
So again, I think it goes back to that. I believe the mouth is wired to the pleasure centers of the brain in calming it down and giving it something peaceful and soothing it out.
Yeah.
So,
Interesting.
yeah.
Yeah. I've done some training that's like bite training while you're strength training for like a different strength effect, which is kind of cool.
I read an article on that, which fascinated me. And I believe that's so true, because when people want to generate more strength, what do? They shrug their shoulders, they clench their teeth, and they use their arms or their legs to sort of put that extra level of strength.
Yeah.
I read that. Yeah.
Yeah. I've always been into experimenting with ideas and then feeling what it feels like in my body. When I was doing it, I felt like I was using my right leg in a different way. Like sometimes I'll use a stick between my teeth, a popsicle stick, and cut in half, because it helps to just breathe through the nose through your workout.
Oh.
But then also, they do say that, like, it's, I don't know how true this is. You could let me know, but, like setting your cranial bones in a better position, or just like kind of spinal alignment in a better position.
When you bite down, you say?
When you bite on something. I just have like a wooden popsicle stick, but I tried it out. I bit down on it and I like squatted, and I'm like, oh, I have a right leg. There's like just different things that I've played with. But yeah, I do think that the body does go to the mouth for soothing pieces and soothing opportunities. And I think it's interesting that through sleep, the body's just like, it's trying to take care of.
Right.
Yeah.
Your rational mind is not doing anything about it. Let me take care of you. And so let's start clenching. That way you calm yourself down a little bit, because your anxiety is too high up.
Yeah. And I have a question. As you said earlier, you said that you aren't usually allowed to look at the sacrum when someone comes in for that kind of diagnosis, right? But have you found any correlation between lower back pains, right?
And it depends on and I always say this, it depends on the individual. And if a person comes to me with neck pain, and again, I've had an issue, I remember years ago, I saw the daughter of a physical therapist, which is very interesting. The mother, I think, lived in Boston. The daughter was in New York. So the daughter came to see me with neck pain. And I worked on her for about 3 to 4 times, just treating the neck and the other areas. She wasn't improving. And so at that point I said, you know what? It's not the neck. So I went straight down to the sacrum. I started working on the low back and sacrum. Her neck pain vanished in one session.
Nice.
In one session. And I said, here it is. It is. You know what? If
the top and bottom of the spine.
it is. And you know what? There's so much work that is done within that top and bottom of the spine to sort of balance itself. I mean, the body, it's amazing to me. The body will always ask for help. If there's an area that is, sort of suffering, it will ask the rest of the chain, give me a hand. And it will always respond with giving it more flexibility. So it sacrifices its flexibility to help out something else. And eventually that area that sacrificed its flexibility may cry out in pain, but it's not the original problem. And so you always have to search for where the original problem is. The individual won't know that. They'll just respond to what part of their body cries out. But as the practitioner, you have to do a little bit of investigative work. So the other thing that is really important, and I've heard other clinicians say this, other holistic clinicians say this, if what you're doing doesn't get a response in several treatments, stop it. Just give, you're not looking in the right place, or there's something more to it that is not being addressed. And if you can figure it out, go ahead and look somewhere else. And if you can't, give it off to somebody else that might have a little more experience that can. And I say this to the clinicians with full respect. Obviously, we all know our strengths and our limitations, but I also say this to individuals who are getting treatment. If you're going to the same person for years and years and years, and you're not getting better, then why are you doing it? You may have a relationship that you enjoy, which is giving you some level of, comfort and healing, but not physical, something else. And I understand that. But if you're really wanting, and I have had patients that I couldn't do anything for, that they were with me for 8 sessions, 10 sessions. We weren't achieving our goals. And I've had to have that conversation with them and saying, listen, I looked at everything that I could, that I understand that could have been an effect to this. You're not getting better. I don't want you to waste your time and money.
Right.
So
Wow,
go look for someone else that will give you the solutions that you're looking for. And I think that that's fair. I have my opinions, and I will always say, you know what, this may be more of a systemic inflammation, and maybe, speaking to someone that has more experience in supplements or, food may be the right path, or homeopathy, but it isn't what I can offer you.
Right.
So go to your answer, go find your answer.
Yeah. And I think that that's a very humbling thing to be able to do, is have this knowledge that that you have that other people don't have, but that person doesn't need that knowledge. They might need some other knowledge. And you say this, we're in this room and you have like hundreds and hundreds of books around you, so it's not like you're not doing the research. But I think that it's also really this true respect and wanting to heal the patient, and like, this is not what we need to do with your time and your money. Maybe you can come back to me when you've sorted something else out.
Right. And that may be right. It's only the individual that would know what benefit they get from a particular intervention. And so as you clearly said to me and shared your feedback to me, which is, thank you so much. It's very wonderful to hear that. But we have to be clear in our goals. When I work with someone, we're clear on, I always say, what would you like to achieve? What can we do? It's usually, when they come to see me, it's usually, I want to get rid of my pain.
Yeah.
That's usually the goal. Or I want to be able to improve my posture. Yeah. I want to be able to get stronger. I want to be able to, breathe better. So right now, for example, I'm seeing a lovely woman who unfortunately had pancreatic cancer. They had to do a Whipple procedure, which removes part of the pancreas, part of the intestine, part of her stomach. She had quite a bit of surgery, abdominal surgery. Wow. And when I saw her, she lost about 50 pounds. Wow. I think she's she wasn't even 100 pounds when I saw her. Oh, she was very cachectic, skin and bones, but she couldn't breathe. That was her issue. Yeah. I can't take a deep breath.
Yeah.
And I said to her, well, with all the surgery that you've had, I'm not surprised, because it's right near the diaphragm. Yeah. And there must be a ton of scarring in that area. And I was so moved by the stories, as I'm often moved by many, many stories. And so she lives in this neighborhood. And I said to her, you know what, I want to help you. In fact, I said to her, come and see me. I'll treat you the first session. I said to her, I'll treat you for free so that you could feel what it would do for you. And in fact, I was, all clinicians, I think, always want to do something and give back. Mm-hmm, yes. And this was the one time, she was a single mother of 2 kids. And I said, I'm I want to give something back to
Right.
society. And I said, I'll happily treat you going forward. She insisted, no, I want to give you something. But we're at a point where her breaths are deeper, which was the goal that we've set. And something else happened. She's starting to put on weight.
Nice.
So now she's up to like 105 pounds, which is amazing. She'd like to go up to 120 pounds. And that's the goal that she has for herself, which I think she will achieve. Remember, once your stomach is for people who undergo surgery to lose weight, that is one of the surgeries, is to remove part of your stomach so that you feel full with less food. And that will make you lose weight. She had part of her stomach removed as a result of the cancer. So we're dealing with, small meals, frequent meals, a choice of food that maybe is more highly caloric versus less caloric, so that she can start to put on more weight. But she can breathe better.
Yeah.
She feels more energetic. I mean, these are goals that maybe a physical therapist won't work on. But as an osteopath, I certainly can work on those goals. Those are, they make perfect sense to me. And I know exactly where we need to work on to get those goals achieved. And again, someone with scar tissue, it'll take more time. 1 or 2 sessions may not be enough, because scar tissue is pretty strong and it's very deep.
Yeah.
So it takes a little more repetition, and there are techniques that I show people. Continue to do this. Continue to release it that way. Put your hands underneath, bring your body forward, take deep breaths, do all that so you can help yourself on a more regular basis. And then when you come to me, I can go more deep.
Yes, I do think that that's super helpful too, is that you provide these like release techniques that we could do daily to continue the process of healing the tissue. And I think that scar tissue, if you want to talk about that really quickly, is something that a lot of athletes deal with, whether it's a surgery around a knee joint, scar tissue for an Achilles issue or shoulder. Do you have anything that you'd like to share with the audience on scar tissue?
Well, no, I the only other thing that I will add to that, because most people think of scar tissue as you hurt yourself, you had surgery, and therefore now you have scarring. But it can also be a response to inflammation. And so when we speak about chronic, like chest inflammations, people who have asthma, they will have developed a ton of scar within the bronchial tree. People who have had inflammatory episodes within their intestine, they will have developed scarring within the intestine. So scarring is a response to any inflammatory insult.
Right. Okay.
And so even myocarditis, inflammation of the heart, will cause scarring of the heart. So those are the sort of footprints that are left behind after disease processes or inflammatory processes, not necessarily part of a disease or part of something else. And of course, injury will cause inflammation, you know, and therefore, in that case, people understand it because it's seen. You can see it. Somebody, a pitcher or a football player or a soccer player rotated their knee or arm out of place, and you could see the damage, and hence there's going to be a ton of inflammation, a ton of injury, and therefore we expect a ton of scar tissue. So scar tissue really, it affects the fascia, the connective tissue. And that's where it lays. And so it steals the individual from movement. So if you think of fascia as a gliding, wet, sort of surfaces, fascia is present everywhere. It's around your arteries, your bones, your organs, your muscles. It's everywhere. And for the regular person, if you ever cook and you take a piece of chicken, that slimy white stuff is connective tissue. That's fascia. And the first time that I saw fascia in the abdomen was I observed this young man was having surgery. And I was invited to observe the surgery. They thought he had an intestinal block. So the surgery was to open him up and to remove that block. And it was the very first time I was doing my PT residency. I was observing so that I could then go to PT school. And I remember being in the surgical room, and the surgeon opened up the abdomen, took off the omentum, which is that apron on top of the organs. And I swear to you, I was so surprised. The small intestine jumped out of the abdomen like a jack in the box.
Oh
and
my
went,
gosh.
I swear, and went all over the floor. And I
Oh
thought,
my gosh.
I mean, I was 17 years old, and the poor young man was my age. He was 16 years old. They were doing an intestinal release of a block to a 16-year-old, which, honest to God, in this day and age, I think they misdiagnosed it, and I don't think that surgery was necessary. But then I see the intestine, the small intestine is very long. It's about 16 feet long.
Yeah.
All over the floor.
Oh my gosh.
And I'm thinking, I hope he doesn't get an infection from the surgery, because it went everywhere. And then you see them sort of pulling inch by inch with their hands to try to unblock the intestine.
What?
They picked up the intestine, they shoved it back in the cavity, and then they closed them up. So a couple of things. I swear, if I didn't already have a negative attitude towards surgery after that experience, I said I will never allow them to open me up if that's the carelessness that they're going to use in putting me back together. The funny thing is that, of course, they don't have to rewind the intestine. The intestine will find itself back.
Oh, interesting.
Yes. I didn't know that back then. But what I saw was the intestines were so wet. They were so wet, but they weren't leaking. The fluid wasn't leaking. And I kept saying to myself, how can they be so wet and slippery and slimy and not drool? And that's the relationship between fascia and lymphatic fluid. The lymphatic fluid and the fascia holds it, and it permeates it, and it creates this layer of moisture on all the organs, on all of the tissues. And part of scarring is that's the problem. If an area is scarred, it can't hold on to the moisture. So that area, that tissue underneath it becomes very dry.
Oh, interesting.
So if you can think about, with regards to, because you're an athlete, if you can think about surgery around an area of the knee, where the scar is, that muscle won't be moistened or wet. It's going to burn. It's going to, right?
Yeah.
So after surgery, you're going to have a ton of scar tissue, and you'll have issues that are associated with now that inability of those areas to keep the organs or the tissues moist. I hope that was a clear example, because for me it was amazing. It was just
it makes sense. That makes sense. And moisture is like healing.
Right.
It is like you need water to heal.
Absolutely. You can think of it as like a saran wrap around it, but that saran wrap is moist. It has water that will sort of hug the tissue and keep it moist. It's a continuous flow. So now you can understand, even in fibromyalgia, right?
Okay.
Painful thing. So if the lymph or the water that is now hugging, the water that is now being fed to hug the tissue is toxic, it's going to irritate the tissue.
Gotcha.
That's when we speak about fibromyalgia.
The tissue becomes toxic through...
It becomes toxic through the presence of metals in your body, mold in your body, parasites in your body, all of these things. Your waters, I'm going to refer to the lymphatic as the waters of the oceans of your body, which is what Dr. Still used to use that term a lot. The ocean of your body, if it's toxic, you cannot have cellular health. You just can't, because you're sitting in toxic fluid, and your tissue is going to be, it can't be healthy. And so as a result, you're going to have stimulation of nerve endings, and hence the pain. It's going to be painful. The area will be painful. So, I think a lot of the pain, chronic pain that people feel, I would probably, if they haven't already, one of the things that I would probably look at is sort of detoxifying your system.
Right.
Not that I could do that, because I'm as an osteopath and as a physical therapist, I can, but just cleaning that system out, cleaning it out. And, you're going to have to look at, it's not just what you eat and drink, which is important, but it's what you're living in, what you're breathing in the house.
Right.
When my children were small, I did a hair analysis to see the amounts of metals in their body. And I believe my son was he must have been 8 or 9, and my daughter was about 6. My son's level of hairs of metal, antimony, which I had never heard of before, was off the charts.
Interesting.
And I said, I don't even know what antimony is. And I looked it up, and antimony is a chemical. It's a metal that is used as a fire retardant in clothes.
Oh.
So I'm thinking all of the pajamas, all the clothes, all of the things that I'm putting on his body, he's absorbing.
Interesting.
Yes. And hence I started to appreciate why some people who are health conscious will only and insist only on pure cotton. And then I said, you know what? Now I'm beginning to understand. The mattresses that you sleep on have a ton of fire retardants. And so you're absorbing it when you lay on it. And so I was starting to look at all this. Now, what's very funny is that my children, both of them live in the same household. My daughter's level of lead was off the charts, not for my son, but for my daughter. So there may be a difference in size. Obviously, he could store more before it's toxic. She was much smaller. And I know that, like my daughter was, she was of an age where she was experimenting with makeup.
Oh, okay.
And I heard so many people speak of the toxins in all of these products.
Yes.
Your makeup, your antiperspirant, your toothpaste, your shampoo, your perfumes.
Yeah.
And they're sitting on your skin, and your skin, the biggest organ in the body, is just absorbing it and taking it in. And where does it go? Into the lymph.
Yeah.
Into the lymph. And it's going to affect you in some way or other. So, you know what? For those people that are suffering from chronic issues, I would really, really recommend doing an analysis of your body just to see even what level of metals you have, what level of parasites, what level of mold, because there's mold everywhere.
Right.
And cleansing that out. And you'd be surprised at how much better you will feel and how much the pain will change. So remember, if there are these things in your lymph, and the lymph sits on the fascia, which covers all your tissues, and you're toxic, your tissues are going to cry out, ouch. And that's pain.
Right.
That's your perception of pain. So I'm beginning to look at this, the fibromyalgia as maybe people that have a ton of toxins with their system. So to look at it from that perspective. So
yeah, that's very interesting. Are there any other medical conditions or diagnoses that you find interesting, or they're really at the forefront these days?
Oh my goodness. So your post-COVID are?
Yeah.
Chronic fatigue is part of the post-COVID. I haven't seen very many, but it's within that same category. They share so many similar symptoms. The Lyme disease,
Right.
they all share such similar symptoms that in a way, there's a, from if you look at it from organs point of view, it's the same tissues that are being affected. It's the same organs that are being affected in all of them, which is the lymph and the fascia.
Oh, okay.
And so, viral loads, which is post-COVID, is something to consider. Most people who have had this diagnosis of post-COVID either have had it after having COVID or after having had, the 5th or 6th booster, which basically the concept, and I say this to people, the concept of that mRNA vaccine is for your body to create the virus.
Yeah.
So that it stimulates the immune system to constantly produce antigen, antibodies to the antigen. And now what we're learning is that when you do that to the body, you're going to get an immune system exhaustion. You can't ask the body to do that. It gets tired. The immune system gets tired. And so then what do you have? You have a high viral load. Right. And then what happens? Post-COVID.
Right. And
symptoms.
that's why there's yeah, there is this fatigue and this, that makes
cloudy
sense.
mindedness. It affects, the central nervous system as well as the rest of the body. So I'm treating this young man. Well, he's in his 40s. I think he's still a young man, who has, he's got a couple of diagnoses. He has SIBO and he has post-COVID. And it's so difficult to distinguish which is playing, which is affecting his symptoms and which is not. And so he is seeing a gastroenterologist for the SIBO, which is really hard to treat from a regular allopathic point of view.
So SIBO, for the audience, is...
SIBO is basically an increase in bacteria within the small intestine. Okay, that's what SIBO is. And so the regular antibiotics didn't do much for him. And then they're putting him on this other course of treatments, which threw off his liver. Now his liver enzymes are high, so they had to take him off of that. But he has, when bacteria overgrows in the system, it affects his energy level. It affects his mental cloudedness. It affects a lot of other systems. So, it's for that, I really would love for him to work with someone, a homeopathic or a holistic practitioner, to get him cleaned out. And, when you're speaking about having bacteria, bad bacteria in this case, even when you take antibiotics, people think that you kill them all off, but you don't. There's always a colony of bacteria that stays in you after that. Your immune system keeps it in check. The problem is when the immune system then becomes weak, that colony grows and comes back again. So, you really have to sort of make sure your immune system is in good order to be able to kill off enough colonies of the bacteria, but keep the rest under check. So he's working on that. And as much as with osteopathy, I'm treating him osteopathically, and I've been treating him now for several months. This is a perfect example of, when I see people, I usually only need to see them. For example, if someone comes in with back or neck, I only want to see them for a couple of times and then we're done. They're good. They've learned what they needed to do. They feel better. They understand the problem. They're gone. But when I'm dealing with someone like this, that has SIBO, that is a continuous up and down, or that has chronic fatigue post-COVID, that is constantly up and down, it really needs a multitude of different professionals to treat the case. It's not just me. It has to be a couple of others. And in this case, it's just me and the medical doctor. And so I think what I was able to do for him was, there was always this feeling of, he felt sick inside. That was the best way that he could describe it. He felt sick, like, affecting his well-being, the sense of well-being. And so after I think we've had about 6 sessions, that's gone. He said to me, which is fantastic. That's gone. And he's getting these windows of opportunity where he actually feels normal for 8 hours. And for someone that has been that sick for a year and a half, 2 years, I think, in his case, getting a window of opportunity of 6 to 8 hours of feeling good is amazing. And, one of the things that I say to people with chronic fatigue or post-COVID is, hang in there, because it's going to be a long ride, and it's going to be a bumpy ride where you go up and down, where he said, when I had those 6 hours, I could go to work. I could do everything I used to do, but then the next day I went backwards again. So this happens a lot. When you're cleaning the system out, that up and down happens a lot. So in that case, I'm going to continue to work with him because he's benefiting. But I wish there would be somebody else from a homeopathic or just a natural practitioner, a naturopath, that would work with the other things.
Yeah, there's so many parts to the body.
There's so many parts to the puzzle and healing and in treating that, there isn't, I've never met only one person that could do everything. And so.
Yeah, I think that it's good too. It's good to get different perspectives on things and not just follow one way.
Exactly.
I also have a few more questions for you, if that's okay.
Yeah, please go ahead.
So one of the things was, what do you wish clients would ask you when they came to see you? Is there like a question that you wish clients would ask you?
That's funny because I don't have an answer to that question.
You can think for a second. You don't have to.
Yeah. I don't know. I don't know. There's nothing that they could ask me that would allow me to help them better. I think most people are wonderful in offering me the medical information. And sometimes I have to dig deeper. So it's what I ask them, I think that will help me to help them better. I don't know. That's a good question. Thank you for asking it. I'm not sure.
It's okay. It's okay. Every question doesn't have to have an answer. I think that as the session unfolds from personal experience, is that you don't remember what injuries you had when you were 18 or until you're like, oh yeah, this thing happened to me. And
I can tell you what they always do ask me. Do you think you can help me? Have you seen anything like this before? And those questions are interesting to me because it tells me how wounded they are.
Oh yeah.
Right?
Yeah.
It tells me have you ever seen something like this before? That person is probably telling me, I've seen so many clinicians that they've never seen anything like this before. Have you seen someone like this? Because if you have, maybe then you can help me.
Yeah.
That's the unspoken words behind that question, which I understand. And my answer is always, you know what? If I haven't seen anything like you, I've seen many people that have something very similar to you. And it's not, the human body is very complicated. Let's see what your body is telling us. You have to, I have to individualize it.
Yeah, there's always patterns and obviously like functional givens in the body. Yeah. But at the same point, you always have to be open to surprises of what can show up.
Right.
You can know the givens and you can know the principles and the parts of the body, but you have to be open to just reading the situation.
I think what people think mistakenly sometimes is that if I have a normal diagnosis, I can be treated. And sometimes, you know what, that's not always the case. So it depends.
But sometimes people like to just have a name to whatever they're going through.
Right. And they don't want to be, nobody wants to be unique when it comes to unheard of diagnoses. Right. Because then their fears that nobody can help them.
Yes.
And the truth is that even in many known diagnoses, we have a standard of treatment, but no one promises that it will help you. So, the more I've spent years in medicine, the more I realize how much we don't know.
I know.
It's amazing.
That's always the consensus of people who've done a lot of research. It's just like,
oh my gosh.
I feel like I actually went to a workshop this weekend and it was all about the pelvis and the sacrum. And my friend was like, how was the workshop? And I was just like, I just walked out of there like, I know nothing. I know everything, but I know nothing at the same time. Not everything, but
a lot of
things. It was just like, I was like, I have so much research to do.
And that's very humbling. Or even, what really, sometimes I get annoyed at this need to be evidence-based. And there's, especially in hospitals, everything you say has to be supported by a quote from an article written by published. And I'm thinking to myself, 8 years from now, this is all going to be BS because as we know more and more, this evidence is going to be obsolete. So it's for a temporary period of time that you think based on this. But a few years later, that's going to be all disproven or modified, and now you're going to have to relearn it again. Yeah. So you know what? Let's be humble. Yeah. And let's see. Let's look at things that have lasted in time for thousands of years, and those have more credence than something that somebody published overnight that may not last the test of time. So it's what do we really know? I mean, really.
Yeah. I love that. Another question I have for you is what are you most thankful for in your practice? What are you most thankful for?
You know, I am most thankful for I guess, the privilege of being asked to help someone heal. And that's a privilege. You know, when people come to me and, you know, let me in on their problem and say, can you help me? It's a privilege, you know, it takes, it takes a lot of opening up and vulnerability for people to say, this is my problem. How can you help me with this? Or how can you guide me? Or how can this be done? And of course, I am also very thankful for being able to service them and possibly, you know, helping them, because that's always, it's funny how I think we're born into this world with, certain attractions. Like for me, it was always healing. From a very young age, I always wanted to be someone that in the field of health, that I would help people. That's what I wanted to do in a physical way. I mean, you can help people in many different ways.
Yeah.
But for me, it was, I want to be able to, you know, make them be able to be pain free, or to walk, or to be strong, or to do the things that they want to do physically, medically. That was my driving force.
Yeah.
And so I guess I am most thankful for having, through the years, acquired the skill sets that will allow me to look at something, figure it out, pinpoint it, and then give them the tools to sort of resolve that. I'm very grateful for that.
Yes, I think that the ability for people to let you into their problem is huge, because a lot of times people don't want to admit that they have a problem that they can't figure out.
Right.
Because we now have Google, so they should be able to figure out everything by themselves, right? And also the ability to help people and like have the knowledge or the experience to, hopefully find that pinpoint of where they can go next and continue to move in the way that they want to move is beautiful. I love that. I love helping people move too.
Yes, exactly.
Yeah. And we're both named Teresa, so
there's a lot of commonalities between us.
Right.
Oh, this is cute.
Right. And when I first met you, I told you my aunt was a physical therapist
Yeah.
as well. So that kind of at a young age helped me to realize that like there are other paths to movement. And yeah, it's beautiful what the body can do when it's moving and healing, and movement can heal the body.
Movement is the essence of life.
Yeah.
You know, it's always that, I mean, how do we define life? Really, one of them is movement, that it moves, not a sitting rock that has no ability. And movement is not just visual and physical. Movement can be a vibrational. It could be a smaller element of, you know, sort of back and forth. It's just beautiful. I agree with you.
Yeah, and back to the name of this podcast, it is the Women in Movement podcast, and I wanted to have you on here because I do think that allowing the body to release its restriction allows for movement within the body to a greater degree. Whether it's an actual shoulder range of motion or it's a digestive situation. But yeah, the idea of movement is so vast, and it happens in an exterior form, but it also happens very interiorly as well. And it's not always this like somatic, like I have to dance in the circles, and that's great. But it's also this beautiful thing of understanding the different areas of your, hips that hold your pelvis in the correct position, or how your stomach issues are affecting your posture, right?
Or how your cranial bones move in this very gentle, rhythmic. It's amazing when you look at the cranial motion of each of the cranial movements. It reminds me so much of the receding waters of the sea, the back and forth movement that happens. I mean, if you've ever looked at aquatic life, and if you look at a seaweed in water, it goes back and forth. And that's basically even the cranial bones, when we identify movement in the cranial sphere, we identify it in two planes, either inspiration, expiration, or flexion, extension, but the bones move forward and back. They move forward and back, or they move out and in. It's a micro movement. I mean, it's millimeters, even less of movement, but even that little movement is important for good health. And that is, the women in movement, the body in movement, whether it's macro or micro, you need that micro movement to feel good. And so all of it is important. And so I'm so glad that you do these podcasts, because I think it's really, a lot of things that people relate to can be seen, but there's a lot of movement that goes behind the naked eye that is not seen. Like even within a cellular, there's vibration within cells, electrons that we don't see, but that's important, because if that's not there, it will affect what we can see or what we see as good health or bad health. So.
Yes, and nowadays I think we're trained very much to see like these big flashy things and not paying as much attention to the little like vibration of a grass blade.
I know,
right? Or all these little micro things
which is even more therapeutic, right?
Yeah. And then when you are able to notice that within your own body, the way your shoulders sit on your rib cage, or the way that's just these tiny, tiny little adjustments that your body is talking to yourself.
Right.
It's this small dance that the body has.
And that's beautifully said.
Yeah.
It is a small dance. It's beautiful.
Yes. So one more question, if that's all right. If you were to give one message to the audience, one last message to everybody listening, what would you want to tell them?
Well, there's a lot that I would want to say. But to be simple is never give up hope. Never, ever give up hope to the idea that you are done for, that you have to live this miserable life in pain and agony, that it's the end, that you've seen so many people and nobody can help you, and therefore you're not helpable. Do not give up hope. There has to always be something that can lift you, that can make you better. And there's so many people that I've met that I have been, that have taught me this lesson. And so that is my message. My message is to keep searching, because what may be the solution that the society sells you as your solution may not be the solution for you. And so look in obscure places, if you have to, for things that might make you less painful or healthier, but always keep searching. That's my message.
Oh, I love that. So beautiful. So I hope that you all keep searching, whether you're in pain or you just are curious about your own body and its relationship in this world. If you wish to reach out to us, you can leave comments, or I will also leave all of your information in the bio, and they can reach out to your email if that's okay.
Absolutely.
All right. And if you ever need to schedule a session with Teresa, I highly suggest it. And thank you so much for your time today. It was a beautiful conversation.
Thank you.
I'm sure it will help a lot of people.
I hope so. Thank you so much for considering me. All right.
Bye-bye. Take care.